Good morning. Today, I am going to discuss breastfeeding versus bottle feeding. Breast or bottle? This is a question that a first-time mom usually asks. But we should remember that deciding to breastfeed or bottle-feed a baby is usually based on the mother's comfort level with breastfeeding as well as her lifestyle. Second, greater immune health. During breastfeeding, antibodies pass to the baby. This is one of the most important features of colostrum, the breast milk created for newborns. Breast milk contains several infective factors, such as the bile salt-stimulated lipase, which is a protection against amoebic infections, lactoferrin, which binds to iron and inhibits the growth of intestinal bacteria, and immunoglobulin A, a protection against microorganisms. Third, fewer infections. Among the studies, the breastfed infants have a lower risk of infection than non-breastfed infants. Fourth, less tendency to develop allergic diseases. Atopic syndrome can be prevented or delayed through exclusive breastfeeding for 4 months, though the benefits may not be present after 4 months of age. Fifth, protection from sudden infant death syndrome. Breastfed babies have better arousal from sleep at 2 to 3 months. One study shows that breastfed reduces the risk of sudden infant death syndrome by approximately 50% at all ages. 6. Higher intelligence. Large randomized trial ever conducted in the area of human lactation shows that breastfed infants have IQs that were 2.9 to 7.5 higher than usual. 7. Diabetes. Infants exclusively breastfed have less chance of developing diabetes mellitus type 1 than peers with a shorter duration of breastfeeding and an earlier exposure to cow milk and solid foods. 8. Obesity. Breastfeeding appears to reduce the risk of extreme obesity in children aged 39 to 42 months. The protection effects of breastfeeding against obesity is consistent, though small. There are the benefits for infants, and now we'll proceed to the benefits of breastfeeding for the mothers. First, bonding. Hormones released during breastfeeding helps to strengthen the maternal bond. Support for a mother while breastfeeding can assist in familial bonds and helps to build a paternal bond between father and child. Second, hormone release. Breastfeeding releases oxytocin and prolactin, hormones that relax the mother and make her feel more nurturing toward her baby. Third, weight loss. Extended breastfeeding can help mothers lose weight. Fourth, natural postpartum infertility. Breastfeeding may delay the return to fertility for some women by suppressing ovulation. That is all about breastfeeding. Now, we'll go on to bottle feeding. First, what is bottle feeding? Bottle feeding is the introduction of milk through a bottle. Commercially prepared infant formula is a nutritious alternative to breast milk. Formula feeding also can make it easier to feed the baby in public and allows the father and other family members to help feed the baby and have an enhanced bonding. Now, we will proceed to the advantages of bottle feeding. First, bottle-fed babies need to be fed less often. For instance, formula milk is not as easily digested as mother's milk. Consequently, the baby feels satiated for longer periods, and this extends the time between feeding at an earlier stage. Second, knowing exactly how much milk the baby has. In case of bottle feeding, a mother knows exactly what her baby's intake of milk is, whereas a nursing mother often worries that her baby has not had enough. Third, anyone can feed the baby. Bottle feeding gives a mother more freedom as she is not tied down to feeding times. Anybody can feed the baby if given the bottle and a formula. Father and older sibling can also participate in feeding and share the burden of caring for the newborn. Fourth, can resume normal life sooner. Mother can rest as the she pleases, does not have to be particular about the nutritious diet. She can begin to diet 6 weeks after delivery. And now that I have discussed breastfeeding and bottle feeding, it is now your chance. Breastfeeding or bottle feeding? I am Camille Barasigan, a second-year nursing student. Thank you very much for listening, and I hope you learned something from me.